So today we are going to discuss about rabies, which is also known as hydrophobia. So it is just acute in onset, okay, highly viral disease, and this spreads to the virus spreads to the CNS. So CNS manifestations will be there like encephalopathy and encephalomyelitis. So what is the causative agent? Causative agent is Lissa virus type 1. So this will cause the rabies virus. So how it will be transmitted to man means through the licks of rabid animals. The animals which already get infected by Lissa virus, through the licks of them will cause this. And some animals like wolves, jackals, bats, cats, dogs also this causes this. Hydrophobia, long and variable, and it has variable incubation period. So what is the major cause of death in rabies means encephalomyelitis. So what are the epidemiological determinants? So agent factors like Lissa virus type 1. As you see here in this structure, we have glycoprotein core and lipid bilayer is there. In the middle we have matrix, and very inside we have RNA nucleic acid. So it is a bullet shaped neurotropic virus. As it grows, as it spreads to CNS, we will call this as neurotropic, and grows mainly in the brain. So containing RNA containing virus, it belongs to Rhabdoviridae. Okay, serotype 1 is most effectively causing the rabies. 2, 3, 4 also cause rabies like illness, but not exactly the rabies. So two distinct major antigens are glycoprotein antigen, which forms inducing viral neutralizing antibodies in our body. Okay, so this is major antigen. Okay, so another one is internal nucleoprotein antigen. So genetically engineering rabies vaccine preparation will see in E. coli. So through E. coli, through rDNA technique, we can prepare the rabies vaccine. So we can prepare rabies vaccine from rDNA in E. coli. So it is excreted in saliva of infected animals. Street virus. So this is also known as street virus. When the very aggressive dogs which are infected with the rabid virus, street dogs, they bite and causing the human infection, then this is known as street virus. So incubation period we will expect from 20 to 60 days in dogs. Okay, what is fixed virus? Fixed virus means this is artificially we are transfusing the virus from the brain of the infected dogs to the rabbit rabbit brains. Okay, rabbit brains, and we are preparing the vaccine. Okay, here incubation period is 4 to 6 days. No inclusion bodies like negri bodies are the inclusion bodies for the rabies. So here we won't see any inclusion bodies. So what are the source of infection means saliva of the rabid animals. In dogs, cats, and saliva may be the virus may be present in saliva for 3 to 4 days and 5 to 6 days before the onset of clinical means symptoms and during the course of the illness. Okay, so coming to the next thing, we'll go with host factors. So what are the host factors? Rabies in man is most dead-end infection. So mode of infection is deep bite or scratch to the infected animal. Bats, most rabies cases are seen in US states of America and Canada. So dogs are the main source of infection. So transmission occurs okay, when infected materials saliva comes in direct contact with the human mucosa. Okay, fresh wounds, if we come direct contact with the fresh wounds like that. Rarely through inhalation or transplantation of the infected organ to anyone will get that, but not by eating the rabid animal we won't get the virus. Okay, incubation period is 1 to 3 months, 7 days, sometimes it is 7 days to many years. It depends on the site of the bite. Incubation period depends on the site of the bite, severity of the bite, number of wounds, amount of the virus injected, and species of the biting animal. Coming to pathogenesis, rabies virus it normally replicate in the muscle or connective tissue. Okay, sorry, we are here. Replicates in the muscle or connective tissue. So cells at or nearby the site of introduction, okay, attaches to the nerve endings from the muscle, and it enters the peripheral nerves. Through the peripheral nerves it enters to CNS, and through CNS it ascends passively through the now retrogradal transmission, okay, neural flow, okay. Virus spreads centrifugally in the PNS to many tissues including skin, adrenal glands, like that. So rabies in man. So in part we have two side headings mainly, rabies in man and rabies in dogs. Mainly we will be focusing on rabies in man, okay. So hydrophobia is the main. Abnormal symptoms we will see headache, malaise, sore throat, slight fever which lasts for 3 to 4 days. 80% patients present with pain or tingling sensation at the site of the bite. Widespread excitation and stimulation of all the parts of nervous system, sensory system, motor system, sympathetic, and yeah, those are involved, okay. Sympathetic and mental system, okay, everything is involved. Patient is intolerant to noise. He can't bear slight noise also, slight mild light also he can't, or any air maybe if there is present, there will be severe muscle spasms will be seen, okay. These are the pathognomic features of the rabies. If we blow some air, violent spasms on pharyngeal and neck muscles will be seen. On examination, increased reflexes and muscle spasms are seen. Dilatations of pupils, increased perspiration, salivation, lacrimation. Some mental changes like fear of death, he might have anger, irritability, and depression. So hydrophobia, mere sight or sound of water, it will provoke him, okay. They provoke the spasm of the muscles of degradation, okay. Then duration of illness will be 2 to 3 days, because after the time period the patient will die, okay. Death will occur mainly due to convulsions, convulsion stage, or this convulsion stage may progress to paralysis, or patient may die at the stage of coma, which is last stage, okay. Coming to diagnosis. So how we will diagnose the rabies patient? Antigen detection we should be doing with the immunofluorescence of skin biopsy and virus isolation from the saliva and other secretions. Neutralizing antibodies detectable in serum or CSF only after the 8th day of infection. Before that we can't see the antibodies. So what is the treatment? No specific treatment. Patient should be isolated in the quiet room until the death, okay. If we need the patient, we should do utmost care, okay. We should protect from the external stimuli, bright light, noise, cold draughts. We should relieve the anxiety of the patient by using anxiolytics or barbiturates to induce sleep in him. So we should reduce the pain by using morphine, so 30 to 45 mg, which gives better results, okay. So we can't avoid the drug because of respiratory depression, but this drug can cure it gives very relaxed to the patient. So we should administer in spite of the disadvantage, okay. For spastic muscle contraction, we should give Curare, D-tubocurare, you remember, like those drugs. Ensure hydration and diuresis. We should giving water by using IV fluids, okay. Intensive therapy in the form of respiratory support and cardiac support you should give. Virus present may be in the saliva, vomitus, tears, urine, and other body fluids. So nursing personnel should wear face mask, gloves, goggles, and aprons. Persons infected having bruises, cuts, if any open wounds are there, they should be handled with utmost care by using PPEs and aprons, okay. Should not directly go and touch them, okay. If we do that, we will also get the virus, okay. That's it. So we'll do prevention of human rabies in next video. Thank you.